you all online, and we're glad to have Dr. Rachael Lee with us. You'll be hearing more about her in a few minutes and the work that she's been doing. And we'll start with an invocation that's going to be led by Dr. Bill Brunson, the senior pastor at Vestavia Hills United Methodist Church. It will be followed by the pledge, which will be led by John Henley with State Farm Insurance, and he also serves as the chair of the chamber board right now. So we'll get started. Dr. Brunson.
Thank you. Let us pray. Gracious God, we give you thanks as we come together today. We thank you for the opportunity to still be able to connect with one another, even when we are separated due to COVID-19. We pray that you'll continue to be with all those who are affected by this virus. Those who are sick, we pray for healing. Those who have experienced loss, we pray for comfort. And for all of us who are trying to find our way through this new world we live in, that you will grant us your grace, that you will guide us each step of the way. As we gather today, we give you thanks also for the life and the witness of Scotty McCallum. What a wonderful servant leader he was, and what a wonderful example to each and every one of us of what it means to put community and others ahead of self. May we all learn from his example as he learned how to follow the one who truly was willing to give his life as a sacrifice for all. We pray that you'll go with us throughout our time together today. Guide us and direct us that we may be the community you need us to be, so that we may be a beacon of light to the world around us. In Christ's name we pray. Amen.
Thank you. Amen.
Please join me in the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Dr. Brunson, and thank you, John, for your leadership and helping out today. I want to make one quick announcement, and then I'm going to introduce our partners in education for the month. And we have, even in the pandemic, we still have some businesses that are opening. We're so thrilled for them and really want to support them. Backyard Market is a new store that is opening where the Joel's restaurant used to be on Highway 31 up by Donato's and Action Martial Arts in that center. And it is going to be a grand opening that we're going to celebrate with them on February 25th at 4 p.m. in the afternoon. And I'm excited about that. It's just what it says. It's a neighborhood market. It's smaller than going into one of the big grocery stores. But if you need milk, bread, whatever, and just want to run in quickly, they'll have that. But they're also serving breakfast, lunch, and dinner. So I hope you all will join us in celebrating with them. We will do a socially distanced, masked celebration with them, and come and go as you want, and starting at 4. So I want to invite you all to attend with us if you can on the 25th of February. If you haven't seen the invite, one was mailed out yesterday, I believe, and it will be on our social media so you can get details there. At this time, I would like to introduce Kelly Botcher, who serves as Vice Chair of Education for the Chamber, and she is going to introduce our partners in education for this month. Kelly?
Thank you, Karen. As Karen mentioned, I act as a liaison between you, our businesses, and our educational system. And one of the focuses is Partners in Education. And today we celebrate the Vestavia Hills City School Foundation partners, and also Vestavia Hills Elementary School East partners. Many of you know, but for those that may want more information, Partners in Education is a program that's been ongoing since 2001. And essentially it connects our businesses with our schools in a way so that the businesses can support our educational system and enrich it through financial support, which could include in-kind donations, expertise, resources, And so in that way, it just creates even a more unified partnership between our entire community and benefits directly our school systems. And in return, the schools recognize these businesses through newsletters and their own forms of publicity, and even what we're doing now. And so I'd like to introduce Tate Stoddard, who is the executive director of the City School Foundation, and also Cindy Eccles, who is the assistant principal of Vestavia Hills Elementary School East, and they will introduce their partners in education. So Tate.
Thank you so much for this opportunity to thank our past sponsors. The mission of the foundation is to provide support to each of our schools and to protect the academic excellence in this wonderful school system. Our 2021 past sponsors are Carr, Riggs, and Ingram, McCallum, Hoagland, and Irby, Yanoski Orthodontics, Iberia Bank, Hillcrest Foundation, Blue Cross Blue Shield Caring Foundation, Vulcan Materials, Elena and Bart Starr, Ashley and Mike Stockard. So we thank you guys so much for your support, and we are just grateful for all the businesses in this community that help us fund our mission. Thank you. Cindy?
Okay, good morning, and thank you so much for letting me join you also to recognize our pies from here at East. First, let me start off. Dr. Richardson hates he was not able to be here. He is out of town in a family situation, so I'm here representing East, which I'm thrilled to do. I wanted to first thank Lindsay Handy, who is our pie coordinator for our PTO, and Lauren Hayes, who is also our PTO president, who coordinates all of the amazing things that happen here, and they support us so much, and we're able to do so many things. I wanted to just start out by sharing just one little piece of information from East that we've been real excited about. The last week or so, we have rolled out a new mascot for East, and if anyone is familiar with the old times at East, I've got an old yearbook here. I don't know how much you can see it, but this is actually 91, but here's this eagle who was a former mascot here for East. It's just through the years kind of gone away, but we've brought the eagle back, all coordinating with the new character education program that all the Vestavia City Schools have been participating in through the Hope Academy at Sanford is the one that kind of organizes this. It's just been a tremendous experience for each school to send teams every month to hear motivational speakers, just to reevaluate our own core values at our schools. And this is kind of how the Eagle came about. I'm gonna show you that we just rolled these magnets out last week, and this is thanks to one of our platinum sponsors who I'll recognize in a minute, but yeah. Our Eagle is, he's right here, but he's got, it's an acronym. The Eagle is for empathy, and they're for our core values: empathy, acceptance, grit, love, and excellence. And last week we featured one word every day for the kids to get excited, building up about our mascot, and there we have videos and lessons and different things. So it's just been a fun time at East rolling this out. More to come still, but I just wanted to share that with you because it is something that's been exciting for us here at East and the kids. We actually let them vote back in November on the presidential elections. We had a little mock election for 3rd through 5th, and we threw in another question: does East need a mascot? And of course, overwhelmingly, the answer was yes. So there's a lot of buy-in here. They kind of think it was their decision that we rolled this Eagle back out. And many of our parents were around when the Eagle used to be here. So it's made it a lot of fun. But like I mentioned, one of our pie sponsors, the platinum sponsors, helped us with the magnets. I'm going to read the whole list of pie sponsors, and just we appreciate every sponsorship that we have. These are our platinum sponsors that we're particularly thankful for. Big Color, Bob Barker. Eco3, Jonathan Handy. Medplex, Dr. Emily Lazenby. Megan Kincaid at RCA Realty. Psychiatry South, Drs. Rebecca Jones, Alicia Austin, Emily Lazenby. Yanowski Orthodontics, Mark Yanowski. Norris Orthodontics, Don Norris. Duncan and Thompson Construction, Kurt Thomas. Blair Moss at Ray and Pointer Properties. Jackson, Howard, and Watley CPAs, Mike Jackson. Chick-fil-A, Sandy Ballard. Acton Quick Care Clinic, Sean Hood. Emily Getty, Realty South. Angela Stevens, Realty South. Harris Coggin Building Company Incorporated, Trip Harris and Tommy Coggin. McDonald's and Stephanie Drew, Vestavia Title LLC, Mark Galano, Ferris, Riley and Pitt LLP, Ken Riley. So again, that's a hefty list, and Lindsay Handy can be given all the thanks for that hard work, but we tremendously thank these sponsors who help us out every day. So thank you so much. It was good to join you today.
Thank you, Cindy. We are grateful for all you all do, and we're thankful for our partners in education and the PTO that so ably recruits these businesses and partners with them. So thank you for all y'all do. Our businesses do make a difference in being and what you all are able to do. So we're grateful for that. At this time, I would have introduced our sponsor, but they must have gotten sidetracked, but I want to go ahead and thank them. Our sponsor for this month is Regions Bank, and they were going to come and join us in person, but they did not, haven't made it. So if they happen to pop in, I'll let them say a few words. But Regions Bank has been a tremendous partner to the Chamber and a great supporter of our city and our schools throughout as long as I've been around, which is a long time. And if we need something, they are more than willing to step up and help us. And I just want to thank Jimmy Knuckles as the branch manager at the Vestavia Hills branch. And Tyler Webb is one of the customer service reps up there. And they do just a tremendous job, and we're grateful for their partnership with us. So I wanted to acknowledge them. And now I would like to introduce John Henley, who serves with State Farm, who serves as the chair of our board, and ask him to make a few announcements.
Thank you, Karen. As Karen said, my name is John Henley, and I'm a State Farm agent here in Vestavia Hills, and I have the pleasure of serving as the chair of the Chamber for the 2021 year. I want to begin by thanking our Chamber champions and our trustees that have committed to be a part of our Chamber in 2021. These are the individuals and companies that have made the decision to participate at the highest possible levels to allow our Chamber to do everything they do to support what we do every day to help our businesses. If you're still interested, you still have time, just contact the Chamber office or Lisa Christopher. And if you're interested in being a trustee or a Chamber champion in 2021, but again, thanks to all those that are involved and help us every day with their financial support and volunteering with the Chamber. Also want to thank our Chamber board. We recently had our retreat for 2021 and worked on our goals and visions for this year, and more of that's going to be coming out as we move forward. As part of that, we will be sending out a survey from the Chamber, which everyone will be receiving by email tomorrow. So please take a look at that and please respond. So you can let us know what your current business is and how you did in 2020 and 2021, and any way that we can help your business as we move forward. So please be on the lookout for that, and please respond when you receive it. Also, in case you guys did not know, we're in February already, which is hard to believe. And Valentine's Day, guys, I'm giving you a heads up because I'm bad like this as well, is February 14th, which is on a Sunday this year. So please remember to go out and support our local businesses and buying those gifts for your loved ones, whether it's a card or whatever, flowers, and go out and support our local restaurants as well. Many of them may be open on Sunday, but be sure to check and just support our local businesses as we celebrate Valentine's Day. And I also want to thank our elected officials for being here today. We have the Mayor of Vestavia Hills, Ashley Curry, City Councilor Kimberly Cook, and City Councilor George Pierce. And we want to thank them for being on our Zoom call today, and thanks for all you do for our community. And I know they had a meeting last night and recognized our first responders who actively participated in the tornado that occurred up in Fultondale, and we appreciate all our first responders and everything they do for our community as well. And Karen, that's it, and back to you.
Thank you, John. At this time, I would like to recognize James Robinson with Spire, who serves as Vice Chair of Programming for the Chamber, and he's done an outstanding job, and I would like to ask him to introduce our speaker for today. James?
Thanks, Karen. Again, welcome to our February luncheon. As Karen mentioned, I'm James Robinson with Spire. We sincerely appreciate you joining us for our February luncheon presentation. we need to take personal responsibility to take care of others. That quote is from our speaker, Dr. Rachael Lee. I too believe, as Dr. Lee, in taking personal responsibility. And yes, we should take responsibility and wear masks to help prevent the spread of COVID-19. Dr. Lee is an expert in all things infectious disease related, ranging from the spread of diseases like the flu to infection, prevention, and control. Dr. Lee is the Assistant Professor of Medicine in the Division of Infectious Diseases and currently serves as Healthcare Associated Epidemiologist for the UAB Health System. Dr. Lee earned her Bachelor of Science degree in biology from Birmingham Southern College and her medical degree from the UAB School of Medicine. She also earned a Master of Science in Public Health, Clinical, and Translational Sciences and Epidemiology from the UAB School of Public Health. Please join me in welcoming Dr. Rachael Lee.
Thank you everyone for having me today. One other part, I am a Vestavia alumnus, class of 2002, so thank you for having me. My parents still live in Vestavia, so it is near and dear to my heart. So I'm going to share, oops, let's see if I'm doing this right. I'm not doing this right. Share this.
Sorry, it's just showing my mug.
Can y'all see my slides okay?
Yes, we can.
Okay, great. So I think this is probably one of the biggest questions that I get now is when will we see relief from this pandemic? And I really want to focus on the vaccines that are rolling out and what we can do in the community to really help stop the pandemic and stop the spread. So if y'all have ever been to this website called Bama Tracker, it's one of my favorite websites. I tend to go to it almost every single day to look at kind of an overall snapshot of what's going on in Alabama in terms of COVID-19. It's very similar to the dashboard that the ADPH puts out, but I feel like it's a little bit easier to read and it has everything on one page. And I think there's some really great news in this page. As you can see, even though we've had a large number of cases and deaths, our hospitalizations, which is this orange picture here, is going down. Our number of confirmed cases is going down, and the number of deaths is also going down. I think these are all just very hopeful kind of points that we have. But how do we get to zero? How do we get out of this completely? What we know right now about COVID-19 is that symptoms take about 2 to 14 days after you've been exposed to develop symptoms. And classically, you get what we call a viral prodrome. So you may have headaches, runny nose, congestion. You may lose that taste, that sense of taste or smell, which doesn't occur in everybody, but in patients that do get that, it's very, very specific, meaning that it may be that you have COVID-19. And then there is a subset of patients where they develop shortness of breath and difficulty breathing and need to be hospitalized. For the vast majority of people, around 80% or so, it feels like the flu. But what we have seen is that some people's symptoms can last for quite some time. And in that sense, it doesn't act like the flu. People have had prolonged illness. There's something called long COVID syndrome. So even if you haven't been admitted to the hospital, you may still be dealing with some severe symptoms from COVID-19. So what have we learned in the past 6 months or in the past year of dealing with this? Like I said, most people experience mild to moderate disease, and it's most common in otherwise healthy people. So when colleges began, we saw a large number of cases, and for the most part, they do fine. They're rarely admitted, which is good. But some have this severe disease. You know, you can have pneumonia, you can have difficulty breathing, low oxygen levels, and it's really disproportionate burden of death in Black and Hispanic people. The thing that concerns me the most, you know, as part of my job, I deal with hospital epidemiology and how infections spread in the hospital. So the percent of infections that are truly asymptomatic is quite high, so 40%. And then we also know that transmission can occur in the period before when symptoms develop, so 2 days before. So you may be around someone and not realize that they are viremic or they have virus in their system, and then they can spread it to you. And I think, you know, every time that I look at treatment options, it is a bit frustrating. I think we as doctors have done a lot better in caring for patients when they're hospitalized. But on the outpatient side, there's really limited options. You know, supportive care is really the big key thing here. And there are these new monoclonal antibodies. So that's what President Trump had received, the Regeneron monoclonal antibody. We also have plasma therapy, but it's really difficult to get patients in to get those therapies because it has to be done in a controlled environment with healthcare workers present. There's also the consideration that you can use steroids if your oxygen level is low, and that's why we recommend that when you are diagnosed to watch your oxygen level and make sure it stays above 94%. On the inpatient side, we do have more options. We have remdesivir, steroids, and then we have some combination therapies where the data has kind of been hit or miss depending on it. There is currently no data for steroids in people that don't have oxygen issues, no data for azithromycin or ivermectin or hydroxychloroquine, zinc, all of these actually have all had randomized controlled trials with the exception of the ivermectin, which is currently in a randomized controlled trial. And they have all shown that they do not work. While they did initially show maybe some hope that it would work in the cells in vitro, when given to patients, it did not work. So we really don't have much for treatment. So the thing that we need to focus on is prevention. So when I think about prevention, I think about two things, right? So we have active immunization, that's our vaccines, and then our passive immunization are these convalescent plasma or monoclonal antibodies. So we're not going to focus too much about the monoclonal antibodies, but instead I want to focus about vaccines. You may have heard this in the media about herd immunity. And what herd immunity is if enough people can get the vaccine quickly in a certain infection, then we are protecting everybody that may not have had a vaccine. So here on this picture on the right, you have someone that has an illness, so let's take measles. But everybody here that was directly exposed to them is immune. Well, that then protects the one person or the two people that have not had the vaccine. Now you can actually do some math to figure out how to get what percent of people need to be vaccinated. And the way you do that is something called a reproductive number. So a reproductive number is how many people are once exposed to you will develop symptoms and illness. And so with measles, for example, which is highly infectious, it's 12 to 14. So one person can infect 12 to 14 people. But for SARS-CoV-2 or COVID-19, it's actually somewhere between 2 to 3. So we think that our goal is to get 60 to 70% of the population vaccinated, and we want to get it vaccinated quickly. Now, there are a lot of viral vaccine candidates that are in development for SARS-CoV-2. What you see here on this right in the circle is the chromosome, all of the RNA here, and each of these different RNA parts help make different parts for the vaccine, for the virus. So you have protein here, and we've got the DNA portion, the RNA portion, and all these different things. And so the vaccine platforms that we have used are based on this, this chromosome. And so the biggest one that you've heard about is Pfizer and Moderna. And so what they are focusing on is something called RNA. So RNA is the little part that turns into a specific protein. And from there, once we have that protein, then our body attacks that and creates antibodies to it. We have also ones like Novavax and Sanofi that are these protein-based vaccines. Then we also have these other ones that are acting on the viral replicating parts. And this is your Johnson & Johnson vaccines. That's the single dose vaccine that you may have heard about. Now, Operation Warp Speed, I think, has this, you know, when you say that something is going at warp speed, that there's this concern that there may be issues with the research behind it. But what I can tell you is that we've been doing vaccine research for quite some time. And because of those platforms available, we were able to leverage that very, very quickly. That plus we already knew where to focus on the virus because of what had happened with Sars and what's called Middle Eastern respiratory virus. And then, you know, unfortunately in July and August, we were having high numbers of cases at that time. And so we were able to test that vaccine in kind of a real world environment. And I think all three of those together has really, really helped in getting some really incredible vaccine candidates out there. Now, the harder part, of course, is getting those vaccines into arms, which I know everybody has seen kind of the media and the issues around it, especially if we can't make enough vaccines for the amount of people that need it. So I thought I would just go through this just to show you how this vaccine works. So remember, we have SARS-CoV-2, which is the virus that causes COVID-19. And what makes it unique is these little spike proteins that are on there. And these spike proteins attach to our cells, and then that's how they get in and cause infection. We know which part on this virus RNA that creates those spike proteins. So the researchers took that out, and then they put it in this lipid nanoparticle. That's the mRNA portion. And then what happens is when we inject it into our muscles, this is in our muscle cell, and our muscle cells read that RNA and they say, okay, I'm going to make this protein. And they'll actually put this protein on these muscle cells. From there, our body is very, very good at recognizing when things are foreign. And so it immediately recognizes this is not normal and I need to make immune cells against that. So this is what happens. So this little cell will eat this and say, this is not normal. And then our T cells will then create our immune response. From there, the T cells work with the B cells, and B cells is what our lasting immunity is. We then have those lasting immune cells that are created. And then anytime we see it again in real life, you know, so if you're exposed again, our body will immediately say, I recognize this as foreign, I have immune cells to that, and then it will work quickly. Now, there are no changes into our own genetic structure, and I know it seems kind of odd that our own muscle cells are putting those spike proteins on there, and yes, those muscle cells will die, but we replenish cells all the time. So this is the process by which we create these immune cells. So what about how do these vaccines work and what are their side effects? And so you can see here that the main side effect with the Pfizer vaccines, you can have pain, is the typical one, and in particular arm injection site pain. Rarely you can have fatigue and kind of nausea, headaches, those sorts of things, but really your symptoms only last for somewhere between 24 and 36 hours. Now the second dose does tend to have more symptoms, and so you do need one dose, and then the second dose is 21 days later. If you do Moderna, it's one dose, and then the second dose is 28 days later. Overall, they're very similar, and if you're comparing it to other vaccines, it's probably a little bit worse than the flu vaccine, but likely a little bit better than the new shingles vaccine. I can tell you that when I received my first vaccine, I had arm pain just similar to the flu. And then the second one, I had arm pain and a headache. But I was still able to work for the whole day. And to me, it was worth it. And it was a sign that my body is making great antibodies. All right. Apologize for the ambulance behind me. So, I'm actually going to mute this for just 1 minute. Okay, they've passed. All right, so, so why do we even get the vaccine? And what's the benefit? Because I know that you've heard of people getting COVID after having the vaccine. So let's look at the data. So these are all the different vaccines that are out there: Moderna and Pfizer, Novavax, the AstraZeneca is only in the UK, it's not here. And then the Johnson & Johnson vaccine. And you can see the number of participants. And those that receive vaccine, how many had COVID-19 versus the placebo. So it's not zero, right? These are incredibly effective vaccines. So somewhere between 95% effective. But what I really think is important to look at is severe COVID-19. And you can see here, we would expect 20% or so of these cases to be admitted to the hospital. And in the placebo group, there was a large number of people that were, that still had to go into the hospital. Whereas in those that received vaccines, they actually, very few were admitted to the hospital. So while you may still be at risk for getting the virus, but if we can prevent hospitalizations, prevent those long-term effects from it, because your body has your immune cells and they're responding to it, then that's what we want. The other thing to note, nobody has died from COVID-19 after they had the vaccine. And then there's been no one that's died from the vaccine and no severe side effects from the vaccine. So this to me is like the one reason why I think everybody should get the vaccine, because unfortunately we cannot predict who's going to be admitted to the hospital or who's going to be asymptomatic. All right, so there are frequently asked questions that I get about the vaccine, so I thought that I would put them in here. So if I've had allergies before, should I receive the COVID-19 vaccine? And there was a recent study that looked from December 14th through December 23rd. There were 21 cases of anaphylaxis that were reported out of over 1 million doses of the Pfizer vaccine. So that's a really, really low case of anaphylaxis. At a lot of the sites, like at UAB, we continue to monitor people for 15 minutes just to make sure they don't have that anaphylaxis reaction. The allergy is actually thought to be due to something called polyethylene glycol that is in the vaccine. So if you have a known history of being allergic to polyethylene glycol, or if you have a known allergy to mRNA vaccines, which that's what the CDC says, even though this is the first mRNA vaccine out there, then those are the only two groups that really shouldn't receive it due to allergies. If you've had allergies to other, like to food or to penicillin or something like that, you can still receive the COVID-19 vaccine. If you've had a severe allergic reaction to another type of vaccine, I recommend that you talk with your doctor first, but they have not seen any issues in terms of people who've had severe vaccine reactions to other vaccines having issues with this vaccine. So another question that I get, so is there a chance that the vaccine could affect fertility? The answer is no, and in fact, that question has come from, unfortunately, a myth that has been kind of pushed around in the media, that there's something in the vaccine that is similar to our own fertility cells. But that has been disproven, and so it is not an issue. Should you get the vaccine if you are pregnant or hoping to get pregnant in the future? My personal view is yes. However, I think that shared decision-making is really important here. Now, the CDC and the Society for Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists all say that while pregnant women were not included in the clinical trials, there are just consistent recommendations that everybody should be eligible to receive the vaccine. You can see how many of these vaccines in pregnancies have occurred, so almost 15,000. So I think the CDC will actually have a pretty good answer in the coming months of how safe it is to receive this vaccine while you're pregnant. Actually, recently there was this, an article that found a woman that received the vaccine while she was pregnant. Her baby had antibodies against COVID-19 once they were born. So that to me is incredible kind of proof of how great these vaccines can work. And the baby, of course, was born safely and without any issues. So other questions that I get, so if I have a condition that affects my immune system, can I take the vaccine? Yes, of course, it is safe to take the vaccine. What we don't know is whether or not if you have an immune system that doesn't work as well, if you'll create the same amount of antibodies that someone that doesn't have that problem will. So you may not get the full effect of the vaccine, but some effect is better than than not getting it at all. So how long will this vaccine protect me against COVID-19? So unfortunately, we do not know the answer to this. We can confidently say that it will be there for at least 3 months, and both Pfizer and Moderna are continuing to check these patients that were initially included in their studies and look at their antibody responses to see how long they last. I had read that it can be up to 5 months at least, and the goal hopefully is that it will be lifetime, but we just don't know because it hasn't been around for our lifetime. There are other, questions that I get. Will this become one of our like yearly vaccines? And, of course, we don't know the answer to that either. I think the hope would be that this will, be the driver that gets rid of the pandemic, and then we'll have to determine how long these vaccines will last in our immune system. Another big question that I get is, what about these new variants and how effective are the vaccines? So there are 3 new variants that we have identified. One is the UK variant, and that UK variant, it appears to be more infectious than the one that's been circulating before that. So what that means is you are more likely to transmit it to one person to another if you're not wearing a mask and you're not following the social distancing recommendations, etc. The second one is the South African variant, and the South African variant is concerning to the public health community, mainly because it appears that those monoclonal antibodies that we have are not working as well for it. And then the last one is the Brazil variant, and that Brazil variant to me is probably the most concerning because it appears that people that have had COVID and had antibodies were not protected against this variant. We do not know a lot about these variants, and we're still continuing to learn. And I think the biggest concern is, we have this vaccine that works, but maybe it doesn't work as well. And I can tell you right now that at least looking at the Pfizer and the Moderna vaccines, you can see down here that the overall efficacy against these vaccines and the UK variants are still incredibly high. So these are the 2 that are available right now. The Johnson & Johnson one appears to be about the same amount of efficacy compared to overall. But we don't know about the South African efficacy yet. And so there's more to come on that. If you go to the CDC's website and just look at variant B117, which is the UK variant, you can see that there have been over 600 cases in 33 states. Alabama has had about 6 or 7 cases so far. And so this is really what we want to focus our efforts on to try to protect one another by getting the vaccine quickly. So another frequently asked question that I get is, if I already have COVID-19 and I've recovered, how do I still need to get vaccinated with COVID-19 vaccine? And the answer is yes. And so really it's all about these severe health risks associated with COVID-19. And then the other part to that is, when we have natural immunity to disease, it looks like our COVID antibodies don't last as long as the ones that we've created from the vaccine itself. So if we can give you a known robust response from one vaccine, whereas we may not know how well your own antibodies responded against COVID, then I think it's worth going through that and getting it. Now, it is recommended that you typically wait about 90 days from when you were exposed or when you had COVID. And that reason is because you likely have your own antibodies that may help to use or to give more people vaccine that don't have those antibodies. Okay, so this I think is probably the most important point here. Do I need to wear a mask and avoid close contact with others if I have gotten 2 doses of the vaccine? And the answer is yes. We still are learning about how much this protects the spread of COVID-19 from one person to the next. I can tell you that we've seen cases of people who have had 2 doses of the vaccine and then have gotten COVID afterwards. And like what that table showed, we expect this, right? But the question is whether or not that person that has COVID, if they can spread it easily to other people. If you have COVID and it's detectable, the answer should be yes. But there is some kind of emerging data that says maybe that virus level is much lower in people that are vaccinated, and so maybe it doesn't spread as well. So we're still learning a lot about how much this does protect us. And so I think, the thing that we want the most as a community is to be able to hug one another and get back together and start getting over this pandemic. And I think that the answer we will be able to, if we can continue to hunker down now, then that should hopefully get us to a point where we can open things back up and be safe. I think that the New York Times really did a really great job kind of showing this visually. So, you know, our vaccination started at the end of December. And if we continue to do what we're doing now and keep masking and distancing as much as we can, and then we decide to lift those in July, you can see that that will be 19 million fewer cases than if we lifted restrictions here in February. So if we lift the restrictions in February, there's this potential that you could see a spike. And that's the concern, especially with all these variants, and we don't know how the vaccine works with the variants, but we do know that masking and distancing and everything else like that do work against the variants. Then I think it's important that we continue to focus our efforts in trying to remain as a community, but at the same time protecting those people that haven't received the vaccine yet. And doing so, we can actually save people's lives by doing that. And so I think that's where us as a community and working through our personal responsibility is most important. Now, there are a lot of unanswered questions. You know, we don't know how long our immunity lasts. Long-term safety data requires years of vaccine follow-up, but I can tell you just based on what we know about vaccines in the past, we think that these are very, very safe vaccines. You know, it's really hard to know if we can draw conclusions about efficacy in some subpopulations, but I think we're getting more of that information. And then also they're doing studies now in children. So if we can get our children vaccinated, that should really help, you know, our teachers and everybody else, particularly since we know that kids can spread the virus as well. So this is all I have right now, but, you know, I really want to open it up to ask any questions or anything like that, because I know it's a lot of information that has been thrown out there. And, you know, I'm an open book. If I don't know the answer, then I promise I'll let you know.
Dr. Lee, there are a couple of questions that have come in, and the first one says, it sounds like there's a large need for convalescent plasma donations. However, Red Cross has limited appointment times. What can be done to help those who want to donate get to do so with these limitations? Is there another place to go?
That is a great question, and I don't know the answer to that, but what I can do is, let me ask my convalescent plasma guru, Dr. Sonia Heath, and get an answer back to Karen, and then that way we can spread that through that point.
Okay, that will be great, and I'll be glad to share that. Next question is, there has never been a cure for the common cold or vaccine for the common cold, which is similar to the COVID-19 virus. To your knowledge, is there concern that any of the vaccines currently available cause recipients to be more susceptible to sickness in the future?
Right, to my knowledge, go ahead. Oh, yeah.
I was just going to say, I think some of that, yeah.
Right. Yeah, to my knowledge, no. And you're right, there are a lot of common colds out there. And the coronavirus itself, there are 4 main ones that are circulating, which has been why it's been so hard to create vaccines against the common cold, because there's so many of these different variants, and we've gotten used to having those seasonal colds. I think with this vaccine, because it was very targeted to the one type of SARS-CoV-2, that's how we were able to create it so quickly. And from my knowledge, it does not make you more susceptible, and it will not make your test for COVID-19 positive. It's not like a live virus vaccine.
Okay, next question is, Alabama's rollout of vaccination has been slow. Is there a reason to be hopeful that it's becoming more efficient? And I've had several questions about the rollout, so I'm not sure how involved or what you can share on that, Dr. Lee.
Right. You know, it's, you know, I think a lot of the data has shown how strong of the community it's been in terms of developing this vaccine. But when you don't have the infrastructure to give these vaccines out, it can be much, much slower. So we know the data, right? The CDC met and it says for people over age of 65, healthcare workers, essential workers, you know, they have this plan out, but we are still waiting to get the vaccine for people. I think there is hope because ADPH has created 8 mass vaccination sites. UAB is one of them. And if we can continue to get enough vaccine, which that's going to be our rate limiting step. I know UAB is geared up and ready if we can have as much vaccine as possible to get up to like 15,000 vaccines a day, which is what we really need. We need high numbers of vaccination daily to get out of this. But now the step is getting the vaccine to UAB to give it to people. And it's going to be the same for the pharmacies across the state.
So that is, again, I've had a couple of questions. One is how somebody said that I've got a 75-year-old sister that can't seem to get the vaccine. What would the process be for them to be able to make this happen?
Well, if they are UAB patients, they should call their UAB doctor and they can get in to be seen at the Hoover Met. We also have Parker High School that's opening up, I believe, this week. And so if they're UAB patients, we can definitely get them here. It may still be a little bit of a delay to get it, but they should get pushed up to the top of the line because they are over the age of 75. The other place that you can look is the Jefferson County Health Department also has a place. And I can try and get some of these links for you, Karen, that we can just send them out to you and for the groups. And I think that would be helpful. But that is another place where I know that they're doing community vaccinations, like in Gardendale and places like that.
Okay, all right. Yeah, we would love to share those. I also had a question about someone that is in, I think, the 1C schedule from the ADPH, but they have diabetes. They don't meet the age requirement, but are diabetic.
Mm-hmm.
So why could they not be in that? They've not been able to get the vaccine and of course are eager to do so. So what would your thoughts be or recommendation be on that?
Yeah, my husband is in the same category. He's a type 1 diabetic and he's on the wait list for that as well. So I think once we can get through 1B, I think it will open up quickly to 1C. And so it may be a little bit of a waiting game for those that meet the definition for 1C.
Okay. All right. Next question. And let's see, let me check my time here. We're okay. And let me know if you need to go before we get these questions all in. How accurate would you say the blood oxygen level measurement on an Apple Watch is? If someone has COVID, would you trust measurements taken on an Apple Watch?
I think it's pretty accurate. I know it's very accurate for your heart rate. But from what I've seen, it seems to be fairly accurate. So if you've got an Apple Watch that does that, that is more power to you. I think that's great.
Yeah. Wish I had one.
I know, me too.
Okay. Any other questions that anyone has? If you want to pop them, this is a golden opportunity. We're so excited, Dr. Lee, to have you with us today. And this is just something that's been top of mind, of course, for everybody in the whole country. But, we're just really, it's the unknown. That's just, I think, what, what's so troublesome is what we don't know. And things like this really help us all in making decisions and the way we respond to it. Did that answer your question? Yes. Okay. And here I've just had excellent presentation. Thanks so much. So any other questions before we let Dr. Lee go? Let's see.
And I'm happy to share my slides to anybody if they would like them. My view is that the more people that know what's going on, that's important to me. So I'm happy to share those.
That's fantastic. Yes, we would love that. There seems to be some difference in the efficacy of different vaccines. Does the consumer have any choice in which vaccine they receive, or is it just what is available?
So right now, it's just what is available, but the good thing is that the two vaccines that are available, the Moderna and the Pfizer, are almost essentially the same. What I've heard with the Moderna is that maybe you don't have as many side effects from it, but if it were me, I would just take what I can get. And I think that's what we have. Even the Johnson & Johnson vaccine, which is only the one dose, even though it's not as good as the other one, I think the good thing behind that is it's still really good in comparison to a flu vaccine. We forget our flu vaccines are not that great. And not to say that we shouldn't continue to use them, but this is still really great data. But now we've been spoiled a little bit with 95% efficacy.
Wow, yeah. In fact, I had a doctor, I heard a call last week when they had the same sort of question, and his answer was the best one is the one you can get first.
Right.
So,
Agreed.
you know, whatever's available. So anyway,
Can I say something?
yeah, please.
Dr. Lee, I want to thank you. This has been probably the best I've seen of boiling it down to where I can understand it. I'm not a big science guy, so this has helped me immensely
Oh,
in
thank
putting it
you.
out there in plain spoken language so we can understand it. So thank you.
Yeah, thank you so much. You
Yeah,
know,
and I
it's
had
been one of my biggest goals is to make sure that everybody knows what's out there, and what we don't know it's very clear to everybody.
Because sometimes it gets lost. I think sometimes when it's trying to come out when it's translated from people, it gets lost in the translation. So this has been great. So sharing those slides and we can get those out will be terrific. Plus
Yeah.
we're videoing it as well.
Yeah, that's fantastic. Okay, I have one other question. Concerns I have heard with Pfizer is that the ultra low temperature storage requirements and need for reconstituting it makes it more susceptible to human error. Is that correct?
Yes, if you do not have the capabilities set up, so you need those special freezers, then yes, potentially you could. And you've probably heard in the news, I think in Seattle, there was like that mass freezer failure and everybody had to come and get a vaccine very quickly. What I will say, you know, for the mass vaccination sites, the Pfizer vaccine makes the most sense because you have so many of them. Everybody has those ultra low temperature freezers, whereas the Moderna makes more sense in the pharmacies, because they don't have to be at that ultra low temperature. And so I think that if we think through how to get the vaccine out quickly, then that would make the most sense. My personal view is that the Johnson & Johnson would be really good for kids because it's only one dose. If I had to get both of my kids to sit down for 2 doses of vaccine, you know, it's going to be difficult, but still worth it.
Yeah, agreed on that. Okay, any other questions out in the audience that now's your opportunity to have the expert address it. Like I said, I had on chat someone else saying thank you for making this so easy to understand. I think we all agree with that. It's like I said, it's Greek to me. So this has been very helpful.
Well, thank you
Okay,
for
I
having
guess
me.
we won't just continue holding here, but Dr. Lee, you have been fantastic and you have made Vestavia Hills very proud. So thank you for taking time and sharing with us. We're proud to call you one of our own and continue the good work. And we look forward to seeing you on TV in the future because I know you're on there often for expert advice also. So thank you so much. And if, without any other questions, we'll adjourn our meeting. Thank you all.
Thank you.
Chat now. Oh, very good.